From VOA Learning English, this is the Help Report. The World Health Organization says vaccinations against disease save the lives of 2 to 3 million children every year. The WHO says almost 80% of babies are vaccinated against preventable diseases like diphtheria, measles, and whooping cough. But 20% are not protected. That is about 22 million children. That is why many efforts to end polio and measles have not succeeded. Jean-Marie Okwobele is Director of Immunization for the World Health Organization. He says one problem is that the cost of newer vaccines is too high for poor countries. Most of the unvaccinated children live in Africa and Southeast Asia. 80% of them live in just 10 countries. The list includes Nigeria, the Democratic Republic of Congo, India, Indonesia, and Pakistan. Dr. Okwobele says limited resources for healthcare systems also reduce the ability of poor countries to vaccinate children. For example, some countries are not able to store vaccines at cold temperatures until they can be used. But the official says there are some improvements in getting vaccines to clinics and children. Dr. Okwobele says a new vaccine against meningitis A in Benin and West Africa has been designed to remain effective at warmer temperatures. The WHO says governments need to vaccinate more children. The UN agency also says health officials and governments must do a better job of telling people about the benefits of vaccines. Dr. Okwobele says that includes making sure people understand that many stories about vaccines are not true. For VOA Learning English, I'm Laurel Bowman. From VOA Learning English, this is the Help Report. The World Health Organization says everyone should have a right to the health care services they need without risking financial ruin. A new WHO report is urging countries to provide health care designed to meet the needs of their citizens. In 2005, all 194 members of the World Health Organization set a goal of providing universal health coverage. But very few countries have reached that target. Most people must use their own financial resources to pay for the health care they need. Since health care needs differ from one country to another, the new report urges every country to create its own system of health coverage. It says the services should include prevention, treatment, rehabilitation, and reduction of pain. And the health care should involve communities, health centers, and hospitals. Christopher Dye is head of the WHO's Office of Health Information, HIV/AIDS, tuberculosis, malaria, and neglected tropical diseases. Every year, he says, about 150 million people face extraordinary medical expenses that they cannot pay. The question, he says, is how to put in place financial risk protection that reduces costs to a minimum. The report shows how research can help countries improve their health system. Dr. Dye said some European countries have continued supporting their social and health services even during this period of financial difficulty. He says that decision is paying off in better health for their people. Dr. Dye notes that the cost of medical care is increasing quickly. Because of that, he says, governments must work harder to keep costs under control. For VOA Learning English, I'm Laurel Bowman.
From VOA Learning English, this is the Health Report. You wake up early one morning to prepare a meal to take to work, and then you forget it. Has this ever happened to you? Researchers say they now have proof that self-reported minor memory loss sometimes led to greater mental decline 6 years later. They reported the findings at a recent conference organized by the Alzheimer's Association. Rebecca Amarillo is a neuropsychologist at Brigham and Women's Hospital in Boston, Massachusetts. She found that individuals who worried about their memory were more likely to suffer a loss of mental ability. Her research showed such persons were likely to have a protein called beta amyloid in the brain. Beta amyloid is suspected of being at least partly involved in Alzheimer's disease. Evidence that the disease develops for an unknown period of time before doctors recognize it is leading to a new area of study. It is called subjective cognitive decline. It involves people who sense that their memory and thinking skills are failing before others realize it. Experts want to inform the public that most people who worry about their mental decline do not develop dementia, the most common form of Alzheimer's. What they are experiencing is truly natural and normal aging. Dr. Ronald Peterson is a member of the Alzheimer's Association National Board. He says people should be tested if they fear they might have the disease. He says doctors might ask patients about other issues like any medicines they are taking or whether they suffer from anxiety, depression, or stress. He says all those things can cause changes in memory. For VOA Learning English, I'm Alex Villarreal.
From VOA Learning English, this is the Health Report. Zambia has one of the highest rates of cervical cancer in the world. 90 of every 100,000 Zambian women get the disease. The Zambian government recently launched a program to vaccinate schoolgirls against the human papillomavirus, or HPV. The virus can cause cervical cancer. HPV can spread through sexual contact. The government hopes to vaccinate schoolgirls between the ages of 9 and 11 against HPV. The program was launched in May at several schools. One of them is the Kalingalinga Primary School in Lusaka. About 100 students there received the HPV vaccine. Euphrasia Mweshi Mutale is a teacher. She was involved in efforts to inform the community about what was expected to be a difficult subject. Ms. Mutale is happy with the early results. She says people involved in the program met with parents and teachers to tell them why it is good to vaccinate the girls. She notes there have been no reported side effects from the vaccine, like high body temperature or skin discoloration. Mulindi Mwanahamuntu is director of the Cervical Cancer Prevention Program in Zambia. He says health officials wanted to vaccinate 25,000 girls, but he says there was some resistance from churches and other groups. Zambian and international health officials are working to end the resistance by educating communities about medical issues. Zambia is third on the World Health Organization's list of countries with the highest death rates from cervical cancer. The country also has the highest cervical cancer rate in Africa. For VOA Learning English, I'm Carolyn Presutti.